Hello, my name is Putri AFINA UTAMI. I'm from Associate's Degree of Medical Laboratory Technologies, Poltekkes Kemenkes Yogyakarta. I will explain my poster about AIV. In total, my poster is Let's Protect Ourselves from AIV. The AIV or Human Immunodeficiency Virus is a virus that targets immune system cells, making an individual more susceptible to various illness and infections. It is communicated through sharing injection equipment or through contact with certain bodily fluids of an AIV positive individual. Most frequently during unprotected intercourse, sex without the use of a condom, or AIV medication to prevent or treat AIV. According to the process of illness, AIV symptoms include: the first is an acute AIV infection, take place in the initial few months following AIV infection. Manifestations include a fever, headache, and a spot on the skin that seems to be empty. Secondly, AIV infection that is chronic because it keeps growing. This stage is harmful for the body's resistance. The sex resembles nocturnal sweats. Third, or the last, is age. Rapid weariness, an indication of weight loss. AIV can spread by having sex. The virus can enter your body through mouth sores or small tears that sometimes develop in the rectum or vagina during sexual activity. Then by sharing needles. Sharing contaminated injection drugs, paraphernalia, or needles and syringes puts you at high risk of AIV and other infectious diseases, such as hepatitis. Then from blood transfusion. During pregnancy or delivery or through breastfeeding, infection mothers can pass the virus on their babies. Mothers who are AIV positive and get treatment for the infection during pregnancy can significantly lower the risk to their baby. Infection common to HIV. 1. Pneumocystis pneumonia or PCP. This fungal infection can cause several illnesses, although it declines significantly with current treatments for AIV or AIDS. PCP is still the most common cause of pneumonia in people infected with AIV. Candidiasis or TRUS. Candidiasis is a common AIV-related infection. It causes inflammation and a thick with chewing on your mouth, so esophagus or vagina. Then tuberculosis. Tuberculosis or TB is common opportunistic infection associated with HIV. Worldwide, TB is a leading cause of death among people with AIDS. It's less common in the US. Cytomegalovirus is common. Herpesvirus is transmitted in body fluids such as saliva, blood, urine, semen, and breast milk. Then, cryptococcal meningitis. Meningitis is an inflammation of membrane and fluid surrounding your brain and spinal cord meningitis. Cryptococcal meningitis is a common central nervous system infection associated with HIV caused by a fungus found in soil. Cancer common to HIV. Number 1, lymphoma. This cancer starts in the white blood cells. The most common early stage is painless swelling of the lymph node in the neck, arm, or groin. Kaposis sarcoma is a tumor of the blood vessel walls. Kaposis sarcoma usually appears as a pink, red, or purple lesions on the skin and mouth. Kaposis sarcomas can also affect the internal organ, include the digestive tract and lungs. High PV-related cancer. These are cancers caused by human papillomavirus infection. They include anal, oral, or cervical cancer. Other complication is wasting syndrome. Untreated HIV or AIDS can cause significant weight loss, often accompanied by diarrhea, chronic weakness, and fever. Then, neurological complications. HIV can cause neurological symptoms such as confusion, forgetfulness, depression, anxiety, and difficult walking. There are many ways to prevent HIV, include not having sex, routine self-testing for the virus and other sexual transmitted infections, abstaining from drugs and alcohol abuse, taking medication that can protect from the virus, not sharing needles, and using sterile needles. And the 3/4, it is appropriate for us to be ourselves as young people to come in order to prevent HIV. Always lead a healthy lifestyle and always remind others to do the same. Thank you.